Hello, I'm King County Prosecuting Attorney Dan Satterberg. Welcome to another edition of Prosecutors Partners. Today we're going to look at the science of drug addiction and mental illness. And how does that inform the way that the criminal justice system is dealing with these very critical cases in our community? We'll explore some of the partnerships that the King County Prosecuting Attorney's Office has developed to help resolve these cases in a way that make us all safer, that help people get better, and save the taxpayers money. This program will talk about some new approaches to drug addiction that we're trying here in King County, and they are approaches that are informed by what we're learning about drug addiction science. First, let's look at the problem. We know that the country is in the grips of an opiate crisis, but these charts really demonstrate how bad it's become. In 1999, about 8,000 people died of drug overdoses. Last year, 64,000 people died of drug overdoses. This is truly a crisis. It is estimated in America now that 1 out of 3 families is touched by the opiate crisis. Someone in their family or a family friend has become addicted. It has become real, it has become personal, and the numbers continue to skyrocket. In fact, last year, overdose deaths went up 19% in a single year from 2015 to 2016. That's more people than were killed by gun violence, car crashes, and HIV/AIDS during their peak years. It's more people than died than American soldiers who died in the Vietnam War. They were killed last year by drugs. And you can see in this chart how steep that climb has become. Now here in King County, unfortunately, we are in the same situation as the rest of the United States. We have a serious problem with heroin. And for the first time last year, treatment admissions for heroin surpassed even those for alcohol. And alcohol has always been our #1 drug problem. In 2014, we had a record number of people die from heroin. Last year, it dipped a little bit. This year, in 2016, it went up to 322 total deaths, the highest recorded total in at least 20 years. And while we hadn't seen the drug fentanyl for many years, last year we started to see it in larger and larger numbers. Fentanyl is a synthetic opiate that is 50 to 100 times more powerful than heroin, and it causes, in many cases, immediate overdose and death. Now, I've read a lot of books about the drug war and history of drugs in America and drug addiction science, and this is one that I always like to recommend to people. It's called Chasing the Scream by a British journalist named Johann Hari. And it talks about the time when drugs were legal in America, where you could go to the pharmacist and get opium, or when Coca-Cola actually had cocaine in it and there were no laws against it, and what has happened since, and the decisions that we have made to criminalize, as opposed to treat as a medical problem, drug addiction. But Hari's most powerful statement to me was this, that the opposite of addiction is not sobriety. The opposite of addiction is connection. And if you think about it, and if you know people in your life who've had drug problems or alcohol problems, what they lose over time is that positive connection. After time, you burn bridges with your family and your friends and your job and anything positive in the community. And drug addicts tend to then congregate among each other in the compulsive search for drugs. The opposite of addiction, if it is connection, then we need to look for ways to connect people who have the disease of drug addiction with positive channels in our community. So science is telling us these things about addiction as well. First of all, that drug exposure alone doesn't cause addiction. It's not a simple matter of a biochemical hijacking of your brain the first time your brain is introduced to the morphine molecule. No, it's more than that. And we know that because 90% of the people who are prescribed opioids, which is a prescription opiate, don't get addicted. But there are a certain number of people who can't control it and who use it to mask other problems in their life. What we're learning is that addiction has deep psychological and emotional components to it. It's not just about the chemical. The second thing we're learning is that addiction is a learned behavior. and a learning disorder. And if that's true, that people learn to use drugs to mask other pain, and it becomes a learned behavior, well then that holds out some hope that it can be unlearned. It can be unlearned through harm reduction and through support. What we're finding out also is that punishment cannot solve a problem that's defined by resistance to punishment. Next, that we think that all people learn better when treated with respect. You know, punishing people who have a drug addiction doesn't do anybody any good. It wastes taxpayer dollars. It puts people in jail who aren't going to get any better. And frankly, when they get out of jail and they still have an addiction, they're at much higher rates of overdose. Finally, prevention programs should focus on alternative ways to help people cope with stress and trauma. At the root of addiction, we believe people who have untreated trauma, who have stress, who have other issues, including mental illness, that they are trying to self-medicate in a way that puts us all at risk. The definition of addiction, as defined by the National Institute on Drug Abuse, is this. Addiction is defined as a chronic, relapsing brain disease that is characterized by compulsive drug seeking and use despite harmful consequences. So it's compulsive. A person thinks about it all the time. And a drug addict, particularly in the opiate area, they spend their entire life seeking and using heroin, despite harmful consequences. That suggests that criminal justice system's approach to punishing people with addiction simply is part of the definition of the disease itself. That harmful consequences alone are not going to keep people from becoming addicts, and are not going to cure people who are addicts. One of the things that holds out hope and the good news in the opiate addiction arena is medication-assisted treatment. There are three kinds of medication-assisted treatments that are commonly used in our community. First is methadone, and we've used methadone for decades in King County. The problem with methadone is while a person can use methadone to avoid the very painful withdrawal symptoms that you get if you stop using opiates, methadone does not keep a person from continuing to abuse opiates. So you can have methadone, which is a daily liquid dose, and a person can continue to use heroin and have all of the problems associated with heroin addiction. What's more remarkable are a couple new medicines. One is called Suboxone, also known as buprenorphine, and Vivitrol. Suboxone and Vivitrol are opiate blockers, which means that they occupy the part of the brain that has opiate receptors built in. Our brain is designed to welcome opiates. Suboxone and Vivitrol block those spots. It means that the person using those drugs will not feel sick when they are withdrawing. They won't withdraw at all because their receptors are occupied. But it will not cause the disorienting euphoria that heroin does, which means that if you're on Suboxone or Vivitrol, you don't have to go compulsively seek your next hit of heroin because you're not feeling sick, and you can have some ability to start to work on the other issues in your life that might be a mess, including the mental health issues that might have contributed to addiction. The final term is naloxone, and that we know as the overdose reversal medicine, sometimes called Narcan, which is the commercial name for naloxone. Naloxone is now carried by most of the police departments in King County. It's also given out by the jail to people who we know have gone to jail, who have detoxed, have suffered through the symptoms of detoxification, but have not in any way kicked their addiction. If you've detoxed and then you go back out into the streets and use heroin again, well, that person is very susceptible to an overdose, because they've lost their tolerance. They go back and use the same amount of drugs that they used before the detox. Well, that often leads to an overdose. So naloxone, properly administered, can reverse the effects of an opiate overdose. What we're finding with medication-assisted treatment is that it provides for a lot of people the first time that they can be stable and they don't have to do the daily search for drugs. And if you think about it, it makes our community safer, the more people who are on medication-assisted treatment. They don't have to go out and commit a crime every day to get the money, to get their heroin. In fact, they can have the Suboxone, which is a tiny film that goes under your tongue, and you use that every day, or Vivitrol, which is a single shot that lasts for a month. So let's talk about some of the judicial approaches to drug addiction. We've had a drug court in King County since 1994, and a couple years ago we celebrated our 20th anniversary. But back when we started it, there were only 12 drug courts in the United States. This was an innovative program. King County Prosecuting Attorney Norm Mailing took a chance, and we put cases into drug court where people can get judicially supervised treatment that they wouldn't otherwise be able to afford. And the state legislature, in reducing the length of drug sentences, put money aside to help fund county drug courts. So it's a well-funded program where we can try to provide some help for people. We were the 12th drug court in the nation. Today there are more than 3,000 drug courts, juvenile drug courts, veterans drug courts, adult drug courts across the nation. That, of course, is a picture of Seattle's own rapper, Macklemore, who came to our 20th anniversary celebration and gave really an emotional speech about his own problems with substances, and then connected with the graduates of drug court. Drug court graduates about 200 people a year in King County. They come into the court facing serious felony charges, and if they succeed in the drug court program, which can last up to 2 years, those charges are dismissed. It's part of the reason that the percentage of inmates in the state prison in Washington State went from 26%, so more than 1 in 4 inmates in the early 90s were there for a drug charge. Today it's about 7%. We have found better alternatives for people with drug problems than sending them to prison. And in King County in 2008, we began treating drug possession cases, which are technically felonies, instead as misdemeanors, which means that nobody goes to prison in King County for simple possession of drugs. About 6 years ago, Seattle embarked on an innovative program that's become a national model. It's called LEAD, stands for Law Enforcement Assisted Diversion. LEAD gives the police officers in Seattle, and this program right now in 2017 is about half of the downtown area. But in the LEAD catchment area, police officers who arrest people for drug crimes, selling a small amount of drugs to support your habit, possessing or using drugs, prostitution motivated by drugs, or some property crimes motivated by drugs, those cases now the police officer has an extra choice. They can book a person into jail like they always have, or the officer can decide to call one of the case managers from the LEAD program to come out 24 hours a day, 7 days a week, and meet that person in a holding cell at the precinct and begin to establish a connection with that person. A connection that can lead them to better health, can lead them to housing, can lead them to services, maybe a hot meal and a shower and a change of clean clothes. The people in the LEAD program, and today there are about 450 of them, many of them have been homeless and drug addicted for decades. And during that time, they have rarely had anybody extend a hand of kindness or an offer of help. If the opposite of addiction is connection, well, LEAD is all about providing that connection. And the case managers, using a harm reduction format, which means that they don't require someone to stop using drugs in order to get help, they're able to establish a connection that one day we hope will lead that person to want to give up drugs. We've had many great success stories individually in LEAD, but it's also a huge benefit for the community. The people who are in the LEAD program are 60% less likely to be rearrested. That means we're not cycling them through jail in and out time and time again. It saves us millions of dollars. They spend less time if they do go to jail, and very few of them end up going to prison. 87% less likely to go to prison if you're being helped in the LEAD program. The LEAD program started here in Seattle and it is now expanded across the country to Albany and Baltimore, Atlanta, all over the country. To more than 20 cities by the end of this year will have the Seattle's LEAD program. Now, one of the more controversial new ideas about combating the opiate addiction crisis is the idea of safe consumption sites. Now, it starts really back in about 1989 when Seattle was one of the first cities to have a needle exchange program. And back then, needle exchange programs were highly controversial. An addict could bring in an old needle, and trade it for a new needle and dispose of their old needle in a safe way. It helped reduce the spread of infectious diseases like hepatitis C or HIV/AIDS, and it kept old, dirty needles and the health hazard off the street. Over time, needle exchanges were accepted as a good approach, a harm reduction approach to drug addiction. Last year, King County had a task force that had 31 recommendations about what we should do to combat the opioid epidemic. One of those 31s, and the one that's gotten the most attention, is the idea of a safe consumption site. And what happens at a safe consumption site, there's one in Vancouver, BC, and there's a couple new ones being established in Canada, and there's several in Europe, is that an addict can come in to the safe consumption site, get clean needles, just like the needle exchange, and then sit down and use their drugs under supervision of a medical professional. So that if they get a bad batch of fentanyl, or they use too much, or they start to overdose, the medical professional can use naloxone to reverse the overdose and save lives. They save lives every week up in Vancouver, and they've never had an overdose death within the safe consumption site facility. Safe consumption sites are designed to provide referrals for medical help, for rehabilitation, for mental health and social services, as well as clean needles and, of course, saving lives. When we talk about new approaches to drug addiction, we have to also talk about mental health issues. Many of the people who have developed drug addictions also have a mental health problem. In fact, many times they're using drugs in order to self-medicate to feel better because of their underlying mental health issues. Back in the 50s, we had publicly funded psychiatric hospital beds for 340 people for every 100,000 citizens. Today, we have 14 beds for every 100,000. We've lost 95% of our inpatient capacity. And that was done because, well, frankly, the 50s were not the time that we want to go back to. They were large institutions that warehoused people, that had experimental medicine, experimental surgeries. So in 1963, President John F. Kennedy signed the Community Mental Health Centers Act that would reduce the size of individual publicly funded psychiatric hospitals on the promise that there would be community outpatient programs to take their place. Unfortunately, that promise has never been fulfilled. Today, it is estimated nationally that for each severely mentally ill person in a publicly funded psychiatric hospital, there are 10 in state prisons. We also know that the streets are the default system for the mentally ill. Our judicial response to mental health issues has been largely in the form of the Regional Mental Health Court in King County. We've had one for more than 15 years. We take cases from all over King County, from municipal courts as well as felony courts. And like drug court, it is a judicially supervised opportunity for a person to get mental health treatment. And after having been in the program for a certain amount of time and kept appointments and been on the kinds of medicines that can help people stabilize, those cases can be dismissed. But it is a way for people to access benefits and treatment and help that they couldn't get any other way. A couple of years ago, we expanded our mental health court to include veterans courts. So we have a representative from the VA hospital in Seattle at the court to help people who have served our country who now find themselves in some legal trouble due to a mental health disease. One of the exciting new innovations that we're pursuing, it has to do with when people come into the court system who are found not competent to stand trial. What's competency? Well, it's a legal test, not a medical test. It asks the question, does the person understand the nature of the court proceedings, and are they able to help their defense attorney in their defense? If they can't, if the evaluation tells us that they don't know what's going on and they can't help in their defense, the typical approach has been to send that person to Western State Hospital for restoration of competency. Today, the wait time to get into Western State Hospital can be many months long. And frankly, for a person who's severely mentally ill, understanding how the court process works might be the least important thing that we can teach them. The idea of competency diversion has emerged as an answer for low-level crimes. I'm not talking about violent crimes, but low-level crimes motivated by a mental illness. What we're doing in King County is a national model. It's called CARD, or Community Assessment and Referral for Diversion. So when a person appears in a criminal court on a low-level case does not appear to be a danger to the community, rather than sending them for months at a time to wait in jail, to wait at Western State, to come back and plead guilty to an offense that they might only have gotten a few days of jail on before, today we are able to divert those cases immediately to one of our mental health providers in the county to start working with that person on the more important issues in their life, including finding the right medication to stabilize their illness. King County is also lucky to have a holistic approach to mental illness as it appears in the community, sometimes under the guise of a 911 call. Today, if the police are called to come out to something that looks like a mental health crisis call, we have the ability to enlist the mobile crisis team, which includes, in addition to the officers, mental health clinicians with training in substance abuse, mental illness, de-escalation, communication with people. They help responders in the field 24/7. We also have an ability for a police officer, much like in the LEAD program, a police officer who arrests somebody for a low-level, nonviolent offense that's clearly being motivated by a mental health issue. Instead of taking them to jail, where they may wait in jail for months, instead the police officer can take them to a crisis diversion facility. It's a 16-bed facility that's an alternative to the jail. It's also an alternative available to hospital emergency rooms, which is another place where people often show up who don't need medical care but are having a mental health crisis. The Crisis Solutions Center in King County is in the Jackson Place neighborhood near the International District. This is a picture of Bill Hobson, who was the longtime director of the Downtown Emergency Services Center. And Bill gave his life to helping people get off the streets and get stabilized and get better and do less harm to themselves and less harm to the community. The Crisis Solutions Center is still run by the Downtown Emergency Services Center, and they run a 16-bed facility where a person can stay for 3 days, and then they can transition next door to a longer-term facility called the Crisis Diversion Interim Services, where they can stay for 2 weeks. And during that time, case managers within this program can help a person not only stabilize medically, but find a longer-term plan. We have a program in King County we call Familiar Faces. And it came out of a study when we looked at the people who had been booked into King County Jail, both the downtown jail and the Regional Justice Center in Kent. And we asked how many people have been booked more than 4 times in a 12-month period of time. So these are people who were booked for public order problems or low-level crimes and spent time in jail and then got back out and then did it again. We can anticipate, based on past activities, what the future holds for these people. In fact, we looked at the 1,400 people who in the last 3 years have been booked 4 or more times in jail and estimated that taxpayer dollars to the tune of $35 million were spent on them. But almost all of that money was spent on due process, on the police, the prosecutors, the public defenders, the courts, the jail. Almost none of that money went to prevent people from coming back. The idea of the Familiar Faces program is to reach out to those people before their next arrest. So earlier this year, the County Executive's Department of Behavioral Health went and took a 60-person cohort of familiar faces and has begun to work with those individuals before their next arrest to prevent the continued waste of taxpayer money and to help people in the way that we're helping people in the LEAD program and in the Crisis Solutions Center to get stabilized and avoid coming back to the county jail. As we've seen, the science of drug addiction and mental illness has begun to inform the way that the criminal justice system deals with these very complex social problems. No longer do we believe that we have all of the answers in the courtroom. We can do it all through innovative partnerships, through criminal justice and community justice. For now, I'm Dan Satterberg. This has been the Prosecutor's Partners. Thanks for joining us.